And welcome back to our final edition of EANM TV. And for this session, we're going to be talking about breasts, or specifically about a meeting that's coming up very soon. I've been joined by Paola Anna Erba, who's the President-Elect, of course. We're going to be talking about this focus meeting that is being planned in Malta. But first, can you just give us an overview of what are the statistics about breast cancer? How common is it as a cancer compared to other cancers?
Hi Roy, nice meeting you back also as President-Elect at the end of this Congress. Breast cancer is the most common female neoplasm, and it's about, just to give you a rough number, 1 or 2 women every 10. So that is a very high number if you consider the
10,
whole...
not 10,000?
No, 10. That meaning when you are in a room and you have 10 women, you know that 1 or 2 of them will encounter breast cancer in their life. I'm saying encountering because it's no longer dying from. That is the good part of this numerosity in terms of patients.
Well, as you know, my partner had breast cancer about 12 years ago. And, she has many friends because of the cohort and stuff. And, I found that it is very, very common. And between them, they just go, 2 breasts dead, 1 breast alive. So there's a very pragmatic approach to it. And an enormous amount of interest. And what I've found as a guy, the evolution of diagnosis, treatment, and technologies has evolved massively over the last just 10 or 15 years. So what is this focus meeting going to be focusing on?
Yeah, you are right, and Roy, it's even more early, because the real challenge with breast cancer starts with the early diagnosis, meaning the screening and the adherence to the screening program.
Or the self-diagnosis to start with.
It is palpation, is self-diagnosis, and then is as soon as you get something, we have now fast track in order not to lose time and to get as soon as possible to the proper treatment the women. So that is the awareness of the disease is the real way to decrease the mortality.
All right, so talk me through the meeting. What is the format going to be like?
So the format as a focus meeting is multidisciplinarity or interdisciplinarity even, patient involvement, because Europa Donna will be a major partner as for Europa Uomo when we had the prostate cancer. So they are similar in terms of numbers and impact of the disease on the population. The difference is that women are younger as compared to men living with majority with prostate cancer. And then the format will be 5 tracks. All those tracks will have a continuous in the disease story, starting from early diagnosis to the new outlook into the future. So that is more or less the format. So we are dealing with diagnosis, pre-surgical management or staging, post-surgical guidance, post-surgical management and treatment and assessment of recurrence.
I mean, it seems to me that the interdisciplinary approach is really much more of a holistic approach to patient care, and it's taken a long time to get to that point.
It is, but that is what our patient needs.
Yeah.
They need proper care, proper support to be ready for the surgical moment. And then after that, they need support to be ready for treatment. And after treatment, proper support to be ready for the next challenge. So it's not just about the treatment, it's the ecosystem where you put the patient to accept and survive also the side effect of the treatment the best possible.
Can you tell me about the Delphi study?
What is this? Nobody knows. Delphi is a methodology, so we prepare the focus in a way that the speakers review literature, and we end up with questions on point of the possible disagreement. So up front, you have to confront yourself and give a sort of score. I do agree to this level of 0 until 9 to this topic. And once that you have scored the questions or the statements, you know how much is the controversies open, and the focus will aim to solve these controversies in a sort of arena setting in order to then go out with a final statement, which is a final publication, where you see literature is not yet supporting those statements, but expert thinks that's the way to go.
Isn't it interesting that, medicine is governed by data and science, but when it comes down to it, very often it's down to informed opinion. So what you're doing is you're taking the existing opinion and moving it into a direction where you can create consensus in order to move forward.
Yes, what we are doing is trying to push interest around clinical trial to go into a certain direction, which your sensitivity or your intuition, thanks God we are not machine, and that's why we won't ever substitute by AI, because there is intuition, and that is what medicine is about. It's not
isn't it the combination of all of these things?
It is. It's a lot of knowledge, because without that it's impossible. A lot of practicality, a lot of art, but it's also intuition and the relation with the patient. I don't know why, but many times you have a patient, you say, this patient, the standard way is not working, I do something slightly different. Do you agree? That's the risk, that's the pro. And then many times the patient is following you, because it's the relation you build up is trust. And when you trust somebody, you are very prone to follow the suggestions.
I mean, that's absolutely the key, isn't it? It's about building trust. You have a broad range of people who are going to be involved in panel discussions. Can you give me an idea of the types of people who are going to be on the panels?
Yes, we will have imagers, so radiologists, because they are particularly in the screening phase mainly. So is EUSOBI, is the European Society of Breast Imaging specialist. Then we will have the surgeon, because the breast surgeon, it's a very specific subtype of surgical oncologist. And you know that, for example, Europe is so on the back of this professional qualification that we do not have a residency training program from breast surgeon or surgical oncologist. They are just general surgeon, but then they need additional competencies in this specific track. And we know by data that having treat patient in a breast unit is improving survival, not quality of treatment, survival. Then we have, of course, the oncologist, as a medical oncologist, as a big group, that they are as an individual participating, and the radiotherapist. But also we will have colleagues from the pathology, because this moment the molecular features of the disease is what is guiding treatment. And we will also discuss about genetic predisposition, but also genetic feature signature in predicting treatment response. So you see, medicine is so complex this moment that if you are not dealing or treating the patient with this interdisciplinary approach, you won't succeed in featuring the proper treatment.
I mean, how much does the emotional and mental well-being of a patient come into this? Because, I know from my own personal experience of various female friends of mine where the aesthetic of the surgery is to her perhaps as important as saving her life, which sounds bizarre.
When I start medicine, which is not so far ago, we used to treat patients with mastectomy. Nowadays, lumpectomy, which is just the nodule removal, or quadrantectomy, so part of the breast, or in case of mastectomy, breast surgery for reconstruction, are the standard of care. So the psychological environment, but also the self-confidence that you get back to after a treatment where you recognize yourself back, it's critical to keep compliance for treatment. And then again, is improving survival.
Excellent. So who is the focus meeting aimed at what level? When you've got interdisciplinary teams, very often you'll have people at many different levels in the hierarchy. So who is the focus meeting for?
The focus is dedicated to everybody who is curious to know how to treat better tomorrow your patient. So it's really to agree on the status in 2025, and then tomorrow going back to be a better doctor or give better option to your patients.
Better informed and being able to be more effective in your role.
Also with the sensitivity, we hope, which is different, because having the patient and the Europa Donna, as I told, will be there, is giving you also a little more twist in being a better doctor in a better way.
So when is it? It's in Malta. What are the dates?
It's the end of January, very 1st of February, 30 January, 1st of February.
Excellent. Great to talk to you. Well done for surviving the Congress. There's been so many sessions. How are you feeling?
Next year, see you in Barcelona.
Okay, Paola, thank you so much. It's been lovely to see you today. And that brings us to the end of EANM TV for this year. Have a very safe trip back home if you've been here at the Congress in Hamburg. And hope to see you again soon. Bye-bye.